Hello, I'm Dr. Gurung. I am admin of this group helpline for IELTS PLAB 1, PLAB 2. I am currently working as an ST4 in psychiatry. I'm doing a dual training in general adult and old age. I've done my PLAB in 2012. I've done a present. Today I'm going to talk something about PLAB exam. Okay, so let us begin. I only have like 9 slides, so I'm not going to bore people with too many jargons. So let us begin. What is PLAB? PLAB is a professional and linguistic assessment board exam. It consists of 2 parts. PLAB 1 is MCQs, which is more like a theoretical exam, and PLAB 2 is a clinical practical exam. Okay, so before you leave PLAB 2, these are the things that you need to be aware of. First and foremost, when you do your medical qualification, make sure that your medical qualification is recognized by GMC. You can go to GMC website, and there is the email address where you can check it. Okay, I like this picture which is given over here, and I love to tell stories, and this picture, it depicts that what you need to do. So before you attempt your PLAB 1 and PLAB 2, you have to make sure that you have got a good command of English, as well as you are able to demonstrate. For that, in order to appear for PLAB 1, you can give either of the 2 tests, which is called IELTS or OET. IELTS has been for a long time, but OET, I think it came in 4 or 5 years ago. I gave my IELTS PLAB 1 and PLAB 2 in 2012, so it has almost been like 8 years. So let us discuss about IELTS. What is IELTS? IELTS is International English Language Test. This test is valid for 2 years. It costs around like 170 to 195 pounds depending on the location. Okay, so when you give your IELTS exam, IELTS can come in 2 versions, general and academic version. Make sure you take the academic version. So the scores that you are expected to get is 7 in each testing area. So there will be 4 testing areas. They will check for speaking, listening, reading and writing. So for speaking, you will normally have like three parts, and normally the speaking test lasts for like 15 to 20 minutes. And that is for speaking. Then it's for listening. What they tend to do is they tend to give like 40 questions, and you will have like the MCQ like tick box. The reading will be same. You will have almost like 3 sections where you are expected to cover like MCQs, and there will be writing. Writing will be divided in 2 parts. One will be in the general, they will give like graphs to interpret, and the second will be more like an essay writing. In order to get 7.5 out of these 4 areas, you need to get at least 7.5 in either of like speaking, listening, reading and writing. Out of those 4, so you need to get 2 of them, more than 7.5, in order to get overall 7.5. But you have to make sure that in each of the 4 domains you have to get 7. Okay, and the tricky bit is you have to get all of the scores in the same test and the most recent setting. Once you pass your IELTS, make sure you have got the original stamp and the test report form number. You might be surprised that in a lot of the social media there are a lot of scams, people who try to sell you the IELTS certificate. Please don't get into this trap. Okay, so the second part is, let us come to OET. OET full form is Occupational English Test. It's quite expensive than IELTS. It costs around like 320. Make sure you take the medical version of this test. I've heard from people that it's easier compared to IELTS. You only need to get grade B in each testing area, so that means that in speaking, listening, reading and writing, at least you need to get grade B. And all of this grade needs to be in the same test. When you're applying for your PLAB 1, make sure you have got the candidate numbers and the grades in the most recent testing test. Okay, so this is, let us recap. You need to give English test before you apply for PLAB 1. The English test can be IELTS as well as OET. For IELTS, you need an average of 7.5, 7, each of the testing area, that is speaking, listening, reading and writing. The test is valid only for 2 years. All of these scores you need to get in one setting. Okay, so we have done the English test. So let us come to PLAB 1. The cost of a PLAB 1 is 240 from 1st of April 2020. When I gave in 2012, it was cheaper. I think it was only half the price than the price which is now. So in PLAB 1, there will be 180 multiple questions, and you will have 3 hours to answer them. Each MCQ starts with a short scenario followed by a question, and you have to choose the right answer out of the 5 possible answers. Now the most common question candidates who appear for PLAB 1 tend to ask is from where to prepare. So I would suggest you can download the PLAB blueprint, which is available in GMC, which is marked against the good medical practice. So typically the question that they might ask from different clinical as well as most probably clinical topics. They are expected to be typically faced by doctors starting on the 2nd year of UK. Yeah, that means the people in UK who have done the medical school have done 1 year experience in NHS. The level tends to be over there. So people might also think about giving different Royal College exams, which can also fetch you to have GMC registration. So compared to that, PLAB 1 is an easier exam. It runs 4 times a year, and you are allowed to give a maximum of 4 attempts. So this is PLAB 1. So just to recap, PLAB 1 is a MCQ exam, 180 question, 3 hours. A scenario will be given, and you will have 5 options to tick. And make sure that you know the syllabus from where the PLAB 1 will be asked. In a year, it happens 4 times, and you are allowed 4 attempts maximum. If people have money, they can also go to do some online courses, as well as there are some coaching classes like Swami, Samson, which can also help you to prepare for PLAB 1. Okay, so let us go to PLAB 2. PLAB 2 is quite expensive compared to PLAB 1. It's £875 from April 2020. The time when I gave it, I think it was almost half the price of what it is now. So PLAB 2 is more like a clinical practical exam. You'll have 16 stations lasting for 8 minutes, and this scenarios, it tries to reflect the real clinical setting, including the morph consultation or acute ward. This exam happens in Manchester. You're allowed 4 attempts, and you need to pass 2 years post giving your PLAB 1. So this is PLAB 2. So let us just recap. The cost is £875. You will have 16 scenarios, each lasting for 8 minutes. This exam happens in Manchester. You're allowed maximum of 4 attempts. You have to make sure that you pass post 2 years after your PLAB 1. So as I discussed before, so this exam is set at the level of let us say someone who have just done the medical school, have done 1 year as an F1 doctor. Okay, so they check you at this level. People who might be interested in doing the Royal College exam, they are tested at the level of people who are already in their respective specialty training. Okay, so where you come here. So let us do an MCQ. This is a sample MCQ which is given in GMC. So the scenario is 89-year-old man with basal cell carcinoma on his forehead, which requires excision he has got dementia, the clinical nurse feels that he is not competent to give an consent to surgery. Which is the most appropriate action of obtaining consent? So the question clearly states obtaining consent. Okay, it doesn't, and this question doesn't ask you to assess the psychiatric problems like dementia. So the question, when you have this kind of MCQs, make sure that know what the MCQ asks for. So the options are A to E. From E is ask the psychiatrist to assess the cognitive function, ask his general practitioner to sign the consent, ask his wife to sign the consent, ask the patient to sign the consent form, ask the surgeon to assess his mental capacity. Okay, so in this, we can exclude B, C and D easily. Okay, so the only confusion people might have is A and E. Okay, but the question clearly say obtaining consent. So in order to answer that, make sure you candidates read about GMC guidelines on capacity and consent. Okay, so consent is something where the patient and the doctor making decision together. So they are asking and obtaining consent on the surgical procedure. They are not asking about dementia. So in this, E would be a suitable answer. Okay, ask the surgeon to assess the mental capacity. Mental capacity in itself is a big topic, so I'm not going to go in detail on that. Okay, so when you prepare for PLAB 2, PLAB 2, make sure that it's normally divided in three areas. So generally the 16 stations that might be coming for an exam. Okay, so the scenarios might be history taking, like physical examination, practical procedures, investigation. So in this, they might have some dummy to take blood test. History station might be from different areas, like it can be a history from medicine, surgery, pediatric. So this is more of like data gathering, technical and assessment skill. So now coming to the second part is it takes test your skills to formulate a diagnosis. That means to know about the difference in diagnosis, explaining something to the patient, and formulating a management plan. So this comes in more of your communication skills, and knowledge. The knowledge part is more in the second part. The interpersonal skills really test your communication skills. So in this, they check you how you approach a station, whether you establish a rapport with the patient. Okay, how you use open and close question, involving the patient and demonstrating your professional and understanding of ethical principle. So in order to show the examiner about your interpersonal skills, make also sure that you read about the GMC guidelines. Okay. I hope this is my last slides. In the last slides, from December 2020, you will begin to run with the 16 station per test with 2 rest station. So that means that you will only have like 14 station. 2 of the stations will be a rest station. Out of the 14 station, you need to pass 10 stations, meeting and extending the pass mark for the day. Okay, so this picture I remember from my 2012. The scenario will be given on a wall. Okay, so you have to clean your hand and read the station, and you will have 8 minutes to go and complete the task. So each of the candidate before they begin the station will be standing in front, and they will be going clockwise from station to station and complete 14 station with 2 rest station. Okay, so hope everything is clear. I'm now exhausted after presenting my 9 slides. Okay, all the best for your future. Take care and bye bye. All the best.